I'm Dr. McFarland. I'm a pediatric dentist and a mom of 3. This is a super controversial topic. I'm really nervous even to post this video. I made some POV posts, so point of view posts, kind of pretend back and forth between a mom and some providers on this topic of tethered oral tissues or lip ties, tongue ties, buccal ties. But I'm nervous to put it out there because it is really heated. But I'm doing it because I have parents asking me, and I want you to know that there are differing opinions out there, that the professional organizations have come to different conclusions than a lot of these providers have. And I just want you to be armed with information and with questions to be asking your providers before you go forward with a surgical procedure for your baby. And I'm going to give you a little lead in about what issue each skit is going to kind of touch on. So without further ado, the first skit I'm going to show you broaches the topic of incentives or kickbacks for these referring providers to the surgical providers. So the ones who are assessing and screening for potential lip tie, tongue tie, buccal tie, and then they are sending them on to the surgical provider who's usually an ENT or a pediatric dentist. Well, nursing's really painful. I'm exhausted because I'm trying to triple feed her and she's still not gaining weight. It shouldn't hurt. Breastfeeding is natural. I saw the picture you posted in the local mommy group and I do believe she's tied. Everyone said from her pictures she has a tongue tie and a lip tie, but my pediatrician said that's just a fad and that you guys are getting kickbacks being paid to refer to these providers to do them. You're not being paid, are you? No. The next skit is going to touch on unsupported claims and kind of fear-mongering. There are a lot of things being attributed to ties without evidence that supports that. And then these referring or surgical providers are encouraging these procedures, which isn't based on sound evidence. So you're saying she has a lip tie and a tongue tie, and if I don't get it released by this dentist that you're referring me to, she could develop speech issues later? Yes, and she may develop a gap between her teeth. Well, I follow this dentist on TikTok and she says the gap between a baby's teeth is normal and that when they're little, it's actually ideal because it means there's room for their permanent teeth to fit in later without crowding, and that most kids outgrow it unless it's a genetic trait. Well, your child may have that genetic trait. Well, for speech issues then. Is there research that supports that a certain type of lip tie results in specific speech issues? That research is being suppressed by people who think that lip tie releases are just a fad. They don't see what I see. Well, I'm worried that scarring from the procedure could actually result in more restricted movement than she already has. Plus, I'm afraid she'll develop oral aversion because the recovery's pretty painful. Oh, it's not painful. Isn't that an image of the postoperative stretches being done on a baby and the baby screaming? I mean, you're reopening a giant ulcer under their lip or their tongue. Those hurt. The next skit just touches on the fact that a lot of the diagnoses of tongue and lip tie is happening by people who it's outside of their scope of practice to do so. So of course, Facebook mommy groups, that's the main place that these are being diagnosed just by pictures. You can't diagnose a functional deficit or a tethering of a tissue by just a picture. But then even providers, so speech language pathologists, nurses in labor and delivery, doulas, and lactation consultants, they're able to screen for this condition, but then they need to refer to a provider, like a medical or dental provider, who technically it's within their scope of practice to be able to formally diagnose this condition. And that's something that not a lot of people realize, and even providers, they are actually saying they are diagnosing these conditions when it's beyond their scope of practice to do so. Hello, welcome. I'm so glad you're here today. Thank you. I'm so grateful to you for working us in so quickly. Oh yes, this is all I do now. Tongue and lip ties have been underdiagnosed for decades, and mothers are finally able to advocate for themselves when their doctors deny their pain and suffering. I can tell you really care about me and my breastfeeding journey. Can you tell me more about these release procedures? It's a simple in-office procedure. No need for the baby to be put to sleep in the operating room anymore. They'll just swaddle her and use a CO2 laser to painlessly release the tissue in a matter of seconds. That sounds amazing. And you said she has both a lip tie and a tongue tie? Yes. Based on your symptoms of pain with nursing and then her heart-shaped tongue tip with the inability to lift, she is tongue-tied. Now, can you make that diagnosis, or should I ultimately let the surgeon be the one to diagnose her? Well, technically, no, I'm only screening. But we'll send you over for both her lip and tongue. And why lip? I know the tissue's thick, but don't we think the main issue is her tongue? Well, her lip frenum is thick. It may be contributing to the nursing pain. I recommend having both the tongue and the lip done simultaneously, so you have a single recovery period. Well, is it a 2-for-1 deal? Like the cost is the same whether you have 1 or 2 done? Oh no, each one's $500 cash, due the day of the procedure. But you just said it's a simple procedure that takes a matter of seconds to perform. Well, what if the real issue is only her tongue? Why would I put her through a second procedure that results in another painful wound in her mouth? Are you being paid to refer to this doctor? The next skit sort of addresses what I would call over-treatment. There is this time pressure and monetary pressure, like, oh, if you act today, you get a discount, or if we do 2 for 1, you're gonna save time and not have to come back. So there's this pressure to do more, and some of those I think are over-treatment. All right, based on your symptoms of pain with nursing and little Anna's heart-shaped tongue tip with the inability to lift the tongue, I am diagnosing her with a grade 4 tongue tie. And you think I should release both her lip and her tongue freedom? Her lip freedom is also grade 4, meaning it attaches close to the tip of her gums and it's thick. Is that appearance consistently associated clinically with difficulty nursing? Well, no, there aren't studies showing that. They're being suppressed. But based on my clinical experience, I think it may be contributing to your nursing pain. Plus, having both the tongue and the lip tie done simultaneously allows little Anna to have a single recovery period, and you avoid a repeat visit to me. I'm still nervous about the procedure. Does it hurt her? Oh no, we use a laser. It's a painless and quick procedure that won't take more than a few seconds to perform right here in the office. Well, is it a 2 for 1 deal? So the cost is the same whether I choose to release 1 or 2? Oh no, well, each one still costs $500 cash, and it's due the day of the procedure. But if you agree to having it done today, we will waive the $200 consultation fee. I don't know if I can make that decision. You said it's a simple procedure that can be done in a matter of seconds, right? And lastly, and I think the most important of these skits, is touching on just the fact that the emotions of the parent are being preyed upon. For encouraging that procedure, they are making them feel like the victim, like you're being denied, you need this, your baby needs this condition, you're being denied for it. And so you're the victim, I hear you, I recognize you, I'm gonna give you this, whatever you need. That I don't really touch on in the skit, but that's where it starts. And then where it ends is when it doesn't go well. If you have a problem, there's restriction afterward, there's scarring, there's whatever, the parent is often blamed. Well, you didn't do something right. You didn't do the exercises right, you didn't do them long enough, you didn't go for the expensive, in my referral ring, CMOT, certified myofunctional therapy afterward. There was something that you didn't do. It wasn't me, the provider, that maybe your child didn't actually need this procedure, or maybe something else was going on. Maybe I actually contributed perhaps even to the problem. No, it wasn't the provider. It was you as the parent that did something wrong. That's the skit. Hi, doctor. Yes, I'm back. Anna's lip and tongue tie release seem to have scarred back down. Well, the normal healing process is scar formation, and these are large, diamond-shaped wounds we're creating with the laser. Did you do the exercises every day? Yes, with every diaper change, and she screamed and cried. It was awful. Well, you may not have been doing them fully or correctly. I did exactly what you showed me. Well, we can re-release it today for no charge if you like. And I'd have to go through the same exercises again? Yes, and I also encourage you strongly to pursue those 2 weeks of therapy with the myofunctional therapist. I can't. They quoted me $1,000, and I already paid $1,000 for the 2 releases, cash, because my insurance didn't cover it. And won't it just scar back down again? I can't guarantee an outcome, but has nursing improved at all? It was less painful immediately after the procedure, but after the wound scarred down, honestly, it hurt worse, and she's still not gaining weight. She actually seems averse to having anyone near her mouth now because of those exercises, including the bottle. I wish I'd never done it. Doctor, there are 3 more babies waiting. So what is my point here? First, I'm going to read it because I had to write it out. I didn't want to ramble too much. I want to educate new moms and young mothers who might be struggling with nursing, and I want to keep them from being taken advantage of, and their babies from going through unnecessary procedures that have painful recovery periods. I worked for a time in a high-volume tethered oral tissue clinic. 2 of my children received tongue and lip tie releases using CO2 laser, and I myself allowed my tongue to be released. My IBCLCs in both instances worked heavily with the clinic, and my own knowledge on the subject was limited. I trusted my provider and their recommendations. After the procedure, I was still never able to nurse one, and the other developed oral aversion, and still to this day is a more picky eater and struggles with tasks like toothbrushing and having people work in their mouth. These procedures are marketed to exhausted, struggling mothers as cure-alls for a growing list of ailments, most notably breastfeeding difficulty. And more IBCLCs are jumping on the bandwagon and getting kickbacks, whether literal cash referral fees or just large, off-the-books gift baskets with iPads types of perks for referring these suffering moms and babies for tie releases with very little effort put forth for actual lactation counseling, positioning, and assessment of both mom and baby. I had an oversupply issue that was missed with my first, and with my second I had a clogged duct. It wasn't addressed with either. It was just, oh, they have ties. Across the country, as more and more of these are being done, we're seeing babies hospitalized, and it's due to missed diagnoses, where the symptoms were attributed to ties, but they had laryngomalacia, hypotonia, even heart defects that were missed. Because they were home birthed, the midwife recommended they go see the dentist, they had ties released. They end up in the hospital, failure to thrive, because they had a heart defect that was missed. So you need to see your primary care physician and rule out other things, don't just immediately assume it's ties. My advice to new moms wondering about lip and tongue ties is to be sure you seek multiple opinions and work with providers you know and trust and who do not have a vested monetary interest in your decision to pursue lip, tongue, buccal, whatever tie release. If you're interviewing a doula, a lactation consultant, a midwife, an SLP, a hygienist, or whatever, ask them point blank if they are receiving any type of benefit by referring to the surgeon they're referring you to for this release procedure. Ask how many patients they see in a day too, and ask how many of them they're referring for these procedures. When you go for a consultation with a surgical provider, ask about pricing and how they came to that fee. Ask what research supports their claims they make justifying the procedure. Often they're citing prevention of future speech issues with lip tie releases. That's not supported by evidence. Ask if their professional organization supports and agrees with their diagnosis and recommendations. Most of these lip ties not a recognized diagnosis. There's not a consistent diagnosis criteria, classification, or associated symptoms that any of these societies, American Academy of Pediatrics, American Association of Head and Neck Surgeons, American Academy of Breastfeeding Medicine, American Academy of Pediatric Dentistry, none of them are recognizing lip ties. Tongue ties the only thing. And even that, it's still being overdiagnosed in my opinion. Ask if there are options to have the procedure performed with a different provider that's covered by your medical insurance, and ask if they'd refer you to them. If they're truly out to help you and the baby, they want to help you on your breastfeeding journey, and they're not in it solely for their own monetary gain, then they won't dismiss any of these questions. They're all valid. Often this procedure is still covered when needed by a medical doctor like a pediatrician or an ENT, an ear, nose, and throat surgeon. As medical doctors, they're also best able to screen for other conditions like I talked about and rule them out so that you are more certain of the diagnosis of tongue or lip tie if that is in fact the diagnosis. Before having any type of surgical release performed, I encourage you to have other systemic diagnoses ruled out by your primary care physician. These procedures should also be occurring with full informed consent, meaning that potential negative outcomes have been reviewed with you. Typically, all I'm hearing providers mention is a small risk of bleeding or infection, and they're like, oh, it's minimal, it never happens kind of thing. But they should be mentioning the risk of scarring and the need for a repeat procedure. That is often the case, many times, because it heals, it scars, and then it's sometimes more restricted than it was to start with. They need to be mentioning that. And then what is their procedure? What is the cost for having it re-released? And then is it painful? Do you have to do exercises again? All these things to consider that they just don't mention. So they need to be talking about risk of scarring, need for a repeat procedure, the restriction with subsequent functional deficits like speech or feeding issues that can result because you have this done, because they end up with restriction from that scarring. A lot of times they say, oh, you need to do this to prevent those, but it could actually cause them. A lot of people don't mention that. And then post-operative pain, that's a huge one. This hurts afterward, especially if they're encouraging you to do exercises. And then nursing, or whatever condition they're claiming it'll treat, it may not improve and it might even worsen. And then oral aversion is a big one. It's painful afterward, and they may become averse orally to anything near or touching their mouth because it hurts. Most of the Facebook mommy groups, chiropractors, myofunctional therapists, speech pathologists, hygienists, dentists, ENTs, pediatricians, and lactation consultants out there pushing these tongue, lip, and now buccal tie releases are trying to make you out as a victim. You're being ignored by your pediatrician or your dentist, and they're dismissing your concerns, and they're valid. They've got lists to show you of symptoms and conditions, all linked, not by evidence though, or accepted by their professional organizations, to the diagnosis of tethered oral tissues. There's a whole society now that's open for tethered oral tissues, and I ask you, is it really that these people are all so passionate about helping moms and babies, or is there a crap ton of money available to be made? I hope it's a little of both, but I think it's more the latter. I encourage you to be a wise consumer and ask questions like those reviewed above before you decide to go forward with any surgical procedure for your baby, and be sure that the provider has you and your baby's best interest at heart. There is a lot of money in these. Just look around. Entire clinics are popping up all over the country dedicated purely to the release of tethered oral tissues. And whenever there's a lot of money to be made, there is great risk of bias and patients potentially being taken advantage of. I encourage you to find providers you trust who are following evidence and the clinical recommendations of their respective professions, and who most importantly have no monetary incentive to push you toward these procedures. That's my 2 cents.